Hello everybody, welcome to this Carlin Cymru catch-up session. Today is the final session for AS Psychology. We have focused mainly on this year's sessions, looking at the different therapies. So we've worked through drug therapy and dream analysis. We've also looked at CBT and systematic desensitization. And then last week we looked at mindfulness and we did some exam technique. Today, what I'm going to look at is more exam technique on the therapies, and I'm going to talk you through some example answers. And we're going to see what's good about the example answers, what maybe we need to work on in order to get more marks with them. So, like I've said in each of the sessions, therapies are really important. They're also named quite a lot on the 2023 advanced information for this exam. So there is lots that you need to be aware of and needs to be a priority in your revision. Like I have said, they are your higher marked questions. They are things that we absolutely need to get right as we revise, and hopefully today's session will help with that. You can be asked to describe the therapy and also evaluate the therapy as well. And I'm going to talk to you a little bit about some of the really important bits when it comes to evaluating. Making sure that we have some examples is really important to gain some higher marks. And then lastly, it is making sure that we have got the appropriate terminology to get us right to the top of that mark scheme. So in terms of an essay structure to use, what does the approach believe about therapy? What's it telling you? How does it link to the assumptions of the approach? These are all questions that you can ask yourself when you're starting to either plan an essay or write an essay in the exam. So what does it believe? That could always be your introduction. So for drug therapy, you could say that the biological approach believes that if something is biologically wrong with something, therefore we need to treat it using biology. So that's always a really nice place to start when doing an evaluation or a question on a therapy, and then linking it to the assumptions. So sometimes, and especially this year on the advanced information, some of the assumptions are actually omitted. And you may have read the advanced information for 2023 and thought, oh, well, I don't need to know the assumptions anymore. But actually, in order to evaluate a therapy or talk about a therapy, you do need to link it to the assumptions. So it is something that definitely can still be in your revision. And then you may be asked to describe the main components of that therapy, which is normally split into a few sections. So you need to make sure that you're writing about key terminology, that you are talking through any evidence that you can bring in to back up your points, and talk through the process. How does it work? How, if somebody was going to take drugs or go through mindfulness or talk about cognitive behavioural therapy, talk them through the process. What are they going to do? What are they going to expect? So these are all things and questions that you can ask yourself. Okay, so on the screen now, we've got our first example answer. And the question here says, describe how the assumptions of the biological approach can be applied to a therapy. And this is a 6-mark question. So not only do we need to know about the therapy, but we also need to make sure that we are confident with an explanation of our assumptions. So the answer that this student has put here reads, the biological approach assumes that all psychological disorders, such as depression and anxiety, have a physical cause. This assumption is based off the medical model and that psychological illnesses are physical illnesses, although that they can be treated like a physical illness, as they are formed from a cluster of symptoms. One example of this treatment would be drug therapy through direct manipulation of biological processes. Okay, really, really nice idea of what the therapy is. Then we've got the link to the two assumptions. Neurotransmitters are based on the idea that they can be in charge of our mood and emotions. Psychotherapeutic drugs, sorry, the handwriting's a little bit. Psychotherapeutic drugs connect this charge by altering the actions of the neurotransmitters by their influence, or blocking or increasing the change in neurotransmitters. Good, that is a nice explanation of neurotransmitters. I would expect to see an example in there. So maybe serotonin or an SSRI, or possibly looking at dopamine and its link with schizophrenia. I think that would really elevate the explanation here. And then the second assumption says, localization of brain function is the idea that specific areas of the brain have different roles. An imbalance in this causes a mental illness, so drugs target specific areas as a way of fixing this imbalance. Okay, nice. For example, the limbic system regulates emotion, and a change in this affects their arousal or their behaviour. Again, nice, but I do still think that this question is lacking a little bit of description. So possibly maybe 4 marks out of the 6, just because there is that lack of an example here, but also it could be slightly more specific, and you could show the examiner, that you really understand the assumptions more. So a nice basis, but we could definitely improve that answer a little bit. Now, something that is really, really paramount when it comes to these questions, like I've said, is terminology. It is absolutely key that terminology is at the forefront of your mind when you're doing these essays. They are used to show the understanding. To show the examiner that you really understand something, you've got to include that quite sophisticated and specific psychological terminology. Things like neurotransmitter, things like serotonin, dopamine, dysfunctional thought diary, they're all just showing the examiner that you can use sophisticated terms, and therefore you will be higher up the mark band. Psychology specific terms will also gain more marks. If you're talking about the process of synaptic transmission, and you say that one chemical moves from one area of the brain to another area of the brain, yes, you are absolutely correct. But if you said that a neurotransmitter moves from the presynaptic neuron to the postsynaptic neuron, it shows that level of detail and that specificness that we really, really need. And like I said, these should be an absolute priority for you when you are revising. So this is a question looking at drug therapy, and you will see that throughout this answer, there is a really high use of terminology. And I think that's why this answer is so well written. So let me read it to you. It says the main components of drug therapy can come from the biological assumptions of drug therapy. These include the medical model, which suggests a mental illness is the same as a physical illness and therefore can be treated in a physical way and should be treated with drugs. It also includes neurotransmitters, which psychotherapeutic drugs can be used to alter the action of neurotransmitters to treat a medical disorder. And it also includes localization of brain function, which suggests we can use drugs to target certain areas of the brain to affect our mood. There are 3 types of drug therapy we can use. Firstly, we can use antidepressants for people with depression. Depression is due to low levels of the neurotransmitter serotonin at nerve endings and can be balanced out by the drug Prozac. Nice, they've included an example in there. Lovely. An SSRI works by releasing serotonin and blocking reabsorption of serotonin at presynaptic nerve ending, so it can be absorbed back at the receptor sites of the postsynaptic nerve ending. Secondly, a drug therapy such as antipsychotics can be used to treat people with schizophrenia. The drugs are also used to treat people who have symptoms of psychosis, such as hallucinations, and work by blocking the receptor site so dopamine is not released. Lastly, anti-anxiety drug therapy is commonly used to treat stress with a drug known as benzodiazepine, for example, Valium. These drugs work by slowing down the activity of the central nervous system and enhance activity of GABA, which is a neurotransmitter that relieves stress naturally in the body. For example, a beta blocker can be used to block the receptor sites for adrenaline and noradrenaline and help to calm the heart rate. To conclude, all drug therapies can use drugs to block the reabsorption of serotonin and block receptor sites where too many of the chemicals are being absorbed. Now, you can see how effective the use of terminology is within this answer. It's packed with terminology, which really, really shows me as the examiner that you have an understanding of the main components of drug therapy and that you have linked it to an assumption. Now, this question doesn't need a conclusion. I am going to talk to you slightly more about conclusions today. However, we don't necessarily need to use conclusions because they are only used for sort of comparison, strengths and weaknesses and evaluation questions. Described questions don't need a conclusion, and because your time in the exam is quite tight, it becomes a bit of a waste of time if you conclude questions that don't need one. But that aside, this is a really, really well answered question. It's got a little bit from the 3 different types of drugs. It's spoken to us about synaptic transmission. It's told us about the different types of illnesses. It's given an example of each one. So it's got things like schizophrenia, it's got Valium, benzodiazepines. They are all ways to really elevate an example answer. So this is a really, really well written answer, something that we should all aim to achieve. Okay, moving on to mindfulness now. Now, one thing I want to show here is that sometimes in psychology and when you're looking at answers, it's very much a quality over quantity when it comes to it, writing essays. And I think sometimes when you see a 12-mark answer, you think, right, I need to write absolutely tons and tons and tons. But if you are concise enough and straight to the point, you can actually achieve full marks by not writing as much as you think you need to. So let me read you this answer. It says, components. Okay, mindfulness is a way of teaching control of our emotions and thoughts by paying attention to them. This is done by focusing on present thoughts and future, and teaches us to become aware of incoming thoughts and feelings and accepting them. The goal is gaining greater awareness of unhelpful thoughts and unhelpful thoughts and listening to them. Thoughts associated with anxiety and depression are noticed as automatic processes, and so we alter their reaction and be reflective. Mindfulness, essential to meditation, is mindfulness breathing, as it removes you from your daily interactions, so it is easier to focus. Guided meditation requires sitting in a comfortable position, and it guides your thoughts and regulating them by bringing attention to breathing and different sensations in the body. The thoughts and emotions prevent intrusion of unhelpful thoughts, and it helps to repress thoughts and learn to sort of not react to negative thoughts. It encourages to conduct informed practices throughout daily life and make a conscious decision to do them by paying attention to your surroundings. When the attention, they should bring it back to the sensations, and it gives you a break from normal life. Sorry about my reading of that. The handwriting is a little bit difficult. But what we've got there is some really key elements of the components, and it is just very, very simply, but very, very well written. Now, maybe we should have an example in here about an informal practice and where the informal practice can take place. So maybe this bit here is lacking a little bit of explanation, but overall, majority of our content from mindfulness is included in that essay. Okay, so this one, explain why a psychologist from the positive approach would say that mindfulness is an appropriate therapy. So this is a bit of an evaluation. Now, this is a 5-mark question, which are quite rare on the exam, but we need to be able to be confident in to also maybe write an evaluation that is for 12 marks, but also an evaluation that is for 5 marks as well. So this question reads, compared to other therapies such as psychoanalysis, mindfulness does not based solely on the individual's past. By assessing the notion of the past causing our present behaviour, client anxiety is not evident. Mindfulness lacks a deterministic belief and benefits the individuals as it does not change their process of thinking, but rather causes them to accept and indulge in it. This indulgence does not frustrate the clients compared to cognitive behavioural therapy, which may result in a guilty feeling regarding their thinking. Okay, really nice point, and they've kind of linked it to CBT, and that's why they're arguing that it is most appropriate. Mindfulness is seen as essential in maintaining moral and ethical standards. Mindfulness enhances leadership skills because mindfulness-based decision making. The study conducted in 2010 by Rudy and Schneiser, I think, demonstrated that individuals who reported high in mindfulness were less likely to cheat on a task and more likely to uphold ethical standards. So a nice little in there as well, which obviously adds to the understanding of this. The thing that I think is lacking here is the conclusion. It says, in conclusion, mindfulness is a strong example of a very ethical study, and it is an appropriate therapy. I think that that could be explained a little bit further, and we could have slightly more evidence. So the examiner here has written, because it allows patients to be anxiety-free and they do not have to bring up their past experiences. That little bit at the bottom that's in a different handwriting is clearly the examiner giving it a recommendation on how to expand on that conclusion. A conclusion should be meaningful and actually add to the essay. It shouldn't be something that's rushed quick on the end because you have to put a conclusion. It needs something that is there that's going to add to the essay. And if they just expand it more, it would be a really, really solid example. Same here as well. So describe how the positive assumptions are applied to one therapy. Positive human traits are as authentic as negative ones, and we strive for fulfillment through development of our signature strengths and virtues. The aim of mindfulness is to enhance our positive characteristics through acceptance. Nice, okay. It also acknowledges free. Mindfulness makes us constantly aware that our present thoughts and feelings and enhances self-regulation by encouraging us to take control of our thoughts and emotions in order to obtain a more positive, productive attitude. It's free will as well as we are taking control of our feelings, and it is central to life satisfaction. And I would agree with what the examiners put here, good, but I would explain slightly more about mindfulness. What actually is it? And I think that is true. In order to reach that top mark band and get that 6 marks, we need to know a little bit more about how those assumptions link to mindfulness. It's a very good explanation of the assumptions, and there is, terminology in there. However, how does it link to mindfulness? Okay, so it's really making sure that you read that question and linking it to that therapy is really, really important also. Moving on from that, I just want to talk to you briefly about conclusions on evaluation questions. Now, I've taken lots of this from the exam board, and I'm going to go through with you just how important it is to make sure a conclusion adds to an essay. So it's an evaluation question. It must summarise all points discussed and come to a decision, a conclusion, at the end, okay? So it's definitely a place to recap what you've already said, but it's got to come to a decision. So have a look at these two conclusions. It's important that children are both punished for wrongdoing and praised when good to ensure that they learn the correct way to behave. With reference to the psychological knowledge, discuss to what extent you agree with this statement. Okay, and this is the conclusion. Overall, the use of conditioning techniques on children clearly has benefits to society and children in some cases, as it can teach them the correct way to behave. However, it's clearly that only certain groups can benefit fully from conditioning, for example, those with autism. Therefore, conditioning techniques should be used on those who need it, rather than all children, as they need to be able to develop their own skills and not simply be responding to society's beliefs about what should be rewarded and punished. That is a really nice conclusion, because they've got a summary, they've got their overall, and then they've also said that therefore this is what should happen, and they've come to a decision. This one, eyewitness reports of children are less reliable than those of adults. Discuss with the reliability of eyewitness testimony with reference to the above context. In short, the information suggests that children's eyewitness testimony, if done in a correct way, such as using investigative interview protocols, can be as reliable, if not more reliable, than adult EWT. However, if done incorrectly, the children are much more susceptible to compliance and suggestibility. Yes, okay, that is still pretty good because it is saying something, isn't it? But I don't know if it really comes to a decision, okay? So that's something to consider. And then I've got some other examples here, okay? Overall, as well as social implications of wealth and that these drugs can cause to the academic world, there is also the potential for harmful effects to occur on people's health in the future, meaning that strict regulation and vast quantities of research needs to take place to ensure that people's safety is maintained. And if the side effects are so great, then the drugs need to stop being so readily available, especially to students whose brains are still developing. So again, a really nice example that comes to a conclusion at the end. There is another example here, but it's lacking a suggestion. So it says, in conclusion, Rain used a very scientific research technique, as PET scans can be repeated and the results can be reproduced. However, due to restricted sample, it's difficult to draw applicable and valid conclusions. Why? What's wrong with that sample? Make sure, when you make a claim, make sure you give a suggestion as to why. So that needs a little more explanation, a little more therefore, in order to be a conclusion that really adds to an essay. So not a strong example. To conclude, it would not be wise to use the individual differences explanation alone, as it would be far more beneficial to use the theories in conjunction with each other in order to nature and nurture view of schizophrenia. So you need to be specific. That's a really important thing. This is absolutely correct to conclude, but you need to be more specific in order for it to really add to that essay. So to conclude this bit on conclusions, you need to state your arguments for. So state the strengths. What have you said? State the arguments against your weaknesses. State the overall view and give a reason as to why you think it is. You can also add an explanation as to what you think should happen in the future, okay? But it's really important that a conclusion, one, is there in an essay, but also that it actually adds to your essay. Thank you very much for listening to this session. I hope that it is useful. The resources will be on the e-sgol website, and thank you very much for joining. Diolch.